Good afternoon. David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID-19 Task Force press briefing for May 20th. Getting started with the numbers, currently in terms of case count here in Shelby County, 97,870 cases have been reported in the pandemic, and that's an increase of 109 new cases yesterday. In surrounding counties, we've had 7,414 cases reported from Tipton County in Tennessee. In Fayette County in Tennessee, we've had 5,129 cases. Crittenden County in Arkansas, 5,723 cases reported, and 21,960 cases reported from DeSoto County in Mississippi. In terms of deaths, we're at 1,648 deaths reported in Shelby County during the pandemic, and there's no new deaths in the last 24 hours. In the vaccine campaign, I'd like to pull up some slides here to show you where we are in our progress there. Starting off with, this is as of May 19th, we're at 49.2% of the campaign target goal has been reached. We have 345,000 people vaccinated in Shelby County. That includes 82,363 people who have had at least one dose of a two-dose series, 262,093 people who are fully vaccinated with either two doses of a two-dose series or Johnson & Johnson. And if we can move to the next slide, one of the things that we have seen is that there's a differential rate around the county. Everybody's not having the same experience. And so those dark brown shaded zip codes, you can see that anywhere from 44 to 62% of the population has been vaccinated in those areas. And at the lightest shade, there's 5 zip codes, 38118, 38115, 38106, and 38126, plus 38127. Those 5 zip code areas have the lowest vaccination rates, ranging from 21 to 25% of the population vaccinated in those areas. So depending on where you live, either more of your neighbors are vaccinated or less of your neighbors are vaccinated. So it's not one homogeneous experience across Shelby County. And if we could go to the next slide, please. This is a look at the vaccination percentage by population, by age. And so you can see that our most vaccinated age group are the 65 to 74-year-olds. We've got 74%, more than 74% of people in that age group are vaccinated. And similarly, more than 73% of the 75 plus. But if you look at our youngest age groups, the 12 to 15-year-olds, those are only about 5.8% of the population has in that age group has been vaccinated. And so at our youngest age groups, we still have a long ways to go. But if you are age 45 and above, at least half of the population in all the age groups beginning at age 45 have been vaccinated by this point in time. And thank you for that. So a couple other things that we can report about that. We have reached 49.2% of the vaccine campaign goal, but we have 36.8% of the population in the county now vaccinated. And we did see a very nice uptake over the last week in people in that youngest age group, 12 to 17 years old. So 10%, or a little over 8,000 people in that, children in that age bracket, 12 to 17 years old, have now been vaccinated. And we've only been able to offer that vaccine to them over the last week. We're averaging about 2,300 vaccinations per day through all sites in the county. And, so we want to say thank you to everybody who's come out to participate in the vaccine campaign. On the cases, would just call your attention to a couple of things before I turn it over to Chief Sweat from the city to talk about the vaccine campaign further. In terms of our look at the active cases, there's a few things that we can say. About 77% of the cases that have been diagnosed in the last 14 days have been diagnosed in residents who are Black. And the other couple notable things there, although 43% of the epidemic overall, the cases have been in the cases, people aged less than 35 years. In the last 2 weeks, 56% of our cases diagnosed have been in people less than 35 years old. And overall for children in the pandemic, going back to 15 months ago, only 12% of the cases overall have been children. But in the last 2 weeks, 22% of the cases have occurred in children, those less than 18 years of age. So what we can, just say right now, those younger age groups, people less than 35 years old in Shelby County, those are the age groups, and that's where the virus is spreading the most and where most of our diagnoses are coming from at this time. So for more on the vaccine campaign, I invite Gina Sweat to the podium.
Hey, good afternoon. Gina Sweat, Fire Chief for the City of Memphis. Glad to hear that there's been a little bit of an uptick in vaccinations this week. We've also noticed a little bit of uptick in first doses at our public community pods vaccination sites over the past week. And I think that a lot of that is attributed to that bringing on that age group 12 to 15. So we definitely encourage everyone, if you've been vaccinated and you have a child or a grandchild or a loved one in that age category, especially those younger groups where the uptake is still low, let's all get together and encourage them to come out and get vaccinated, because it is our best shot to beat COVID-19. As I reported on Tuesday, yesterday was the last day for the CVC site. The FEMA and DOD people have left that site, but just be reminded the Pipkin vaccination site is still open. We do have changing hours there. The hours, we're going back to 9 to 6, Monday through Saturday, and there's no appointments needed at the Pipkin site. We have plenty of capacity there compared to what we've been experiencing on the ground of late. So once again, I do challenge everyone to come out and let's try to tax our availability and see if you can make us have to bring some more people into work to get shots in arms. I do want to express my appreciation through, and I'm sure on behalf of both mayors, this has been an extraordinary event, this pandemic. And throughout it, what I have seen over and over again, starting with testing, even through now the vaccine sites, is we have relied heavily on volunteers to help us navigate this pandemic. And I can only say 2 words: thank you. Memphis is known for being a philanthropic community. People are very giving here, not only of their financial things, but also their time. So for everyone, whether you volunteered 1 day or many, many, many days, on behalf of a grateful city, thank you. We're not quite there yet, so we still need help and we still need volunteers to help us get through this, but we are extremely grateful for all the community members who've come together to try to help us through this pandemic. So for scheduling changes at our community vaccination sites, I want to remind everybody, 12 and up, you can still get vaccinated, and we have plenty of opportunity and capacity. As I said, the Pipkin building will remain open Monday through Saturday from 9 to 6, no appointment necessary. Tomorrow will be the last day for the First Baptist Bartlett site. So if you intended on getting vaccinated at that site, you've got today and tomorrow to get out there and get it done. Thursday, next week, we have a couple of other sites. Thursday, May 27th will be the last day for the Gill location to get vaccinated. And next Saturday will be the last day for the Raleigh location. That's the Raleigh location. Next Saturday, May 29th, will be their last day there. So if you've been putting off getting vaccinated and you want to go to those sites in your community, you need to get it done pretty soon as we start to kind of scale down. And what I heard when David was speaking is we're averaging around 2,300 vaccines a day, and it seems like about half of those are being administered at our community pods. To me, that's a good sign. That means we're starting to normalize vaccines. People are getting them at their doctor's offices. People are getting them at different locations, their drugstores, and like that. And that's the way vaccines, that's how we normalize the process and get started to get back to normal. So we do have, as we kind of transition from the large mass community sites, we're going to really start focusing now on more of the community vaccine pods. again. So just a few that are coming up this week. On Friday, we have an event at Riviana Foods at 2314 South Lauderdale from 12 till 4 o'clock, and we'll be administering Pfizer and J&J at that location. On Saturday, we will have an event at Greater Community Temple North, 924 Dunlap Street, and that'll be from 10 to 3, and we'll also be administering Pfizer or J&J at that location. I'd also remind you of the event we have Sunday on Bill Street, Handy Park and Bill Street, Vaccine on the Green, will be 10 to 4. You come down there, that's a partnership with Satellite Healthcare in the city of Memphis. You get vaccinated, and they'll be giving out free meal vouchers for a Bill Street restaurant, and there'll be live music and some educational materials at that location too, if you have any questions about getting vaccinated. Also on Sunday, we have a community pod at Salon Monarca, located at 4350 Stage Road. This event will run from about 12 to 5 p.m., and we'll also be offering Pfizer and J&J at that location. And as we start transitioning to get more community outreach, you heard Mayor Harris speak about door knocking and getting out in the community, canvassing zip codes, different zip codes. So we will start a little bit more robust work on that. You'll probably hear more about it next week. We'll be doing some canvassing of neighborhoods and passing out educational information and trying to encourage people to get vaccinated. And we'll be starting off, we'll be focusing on those zip codes with the lowest uptake of vaccine for now. And last but not least, I want to remind you of the car sweepstakes, a shot for a shot. The shot at getting vaccines, your best chance of staying healthy and safe, keeping your family and friends healthy and safe, and you also get a shot at winning a brand new vehicle. So this is open to any Shelby County resident, age 18 and older, and all you have to do is come out and get vaccinated. So anybody who's been vaccinated so far, up until May 31st, you have an opportunity to register, and you can all of this information can be found at our website, covid19.memphistn.gov, covid19.memphistn.gov. And with that, I'll open it up for questions.
Kelly Roberts, WMC.
Hi there. First, I would like to talk about those zip codes that still aren't seeing the lowest uptake, at least in Shelby County. When it comes to either the bigger public vaccination sites that are kind of scaling back, including the Raleigh and the Gill location closing, and then more emphasis on the pods, I'm wondering, are any of the pods that you recently named going to be in those zip codes? And do any of those zip codes fall into the immediate area surrounding the Raleigh or the Gill site that are closing?
So there is one event on Stage Road, so that is definitely within that area. And the other one, North Memphis. So all of these fall either within those zip codes or very close to those zip codes. Unfortunately, we've seen in our community pods, we've seen some of the same downward trend of people coming out. Some of our earlier community pods, we were getting up to 1,000 people at some of the events, and now we're feeling very good if we get 100 or up to 200 at some of these events. So we're definitely going to continue trying to push information out, trying to reach out into these communities as best we can. But we definitely, we're trying to take the vaccine to those areas as much as we can, but we still got to have the people that come out and get vaccinated when we bring them to them.
In my second question, dealing with the optimistic news of just seeing some kind of increase in the younger people participating in the vaccine campaign, it sounds like you guys saw the uptick once the 12 to 15-year-olds could come out. So do you guys credit a little bit on the, seeing that uptake to the parents that are involved, who may be a big part of the decision-making process for those young people instead of the adults, kind of the 18 to 30 crowd who would be making the decision on their own, yet we haven't seen as high of uptake. So do you kind of credit the parents with this optimistic uptick in younger people?
Absolutely. For most of these, especially 12 to 15, someone has to bring them to the site. And definitely the parents Our thinking is probably the parents who have already been vaccinated have been waiting. They've been asking for a long time about when the children would be brought on board. So I think that's what we're seeing. We're seeing parents that want to get their children vaccinated so they can get back to school, back to playing sports, back to activities that young kids enjoy and like to do for their development and their growth. And I think that's what all the community wants, especially the children have been really impacted by the pandemic and not being able to do in-person school and some of the other socialization things that's very important for youth to develop.
Jane Roberts, Daily Memphian.
Hey, thank you. I wonder if we could get some comment about the increase in hospitalization now over the last, what the numbers were 60 days ago. Also, increase in deaths.
Thank you, Jane. So tomorrow, when we do the Joint Task Force briefing, I think we'll be able to show that actually we seem to have peaked on our hospitalizations and are starting to come back down. So in terms of recent uptake in cases and hospitalizations following Easter, I think we've weathered that surge, and we are now beginning to see the numbers of people in the hospital come down and the number of people in the intensive care unit come down a little bit over what they were a week ago. So we seem to have turned a corner, at least for the moment, in those numbers. I don't have them with me off the top of my head, but we'll be showing those tomorrow in the Joint Task Force briefing.
Thank you.
Did you have a follow-up, or was that your only question?
That's it. Thank you.
All right, thank you.
Catherine Burgess, Commercial Appeal.
Hi. I know in the past holidays have been worrisome. Are we at all worried about Memorial Day gatherings, or has that really changed because of the vaccine?
Well, you're asking somebody who's paid to worry. So yes, I'm worried about the coming Memorial Day weekend, because a year ago our experience was that the summer surge really kicked off following Memorial Day. So as we head into each one of the holiday periods, we have seen them drive increases in cases of various size. We definitely saw the summer increase began a year ago right after Memorial Day and did not begin to subside until after July 4th. And so, yes, there's some trepidation about heading into the summer months. But you mentioned the other key factor, right? The vaccinations. We now have over 345,000 Shelby County residents vaccinated. That's something we did not have a year ago. And we do believe that all of our case numbers right now would be much higher if we did not have that level of participation in the community with vaccine, because we know that almost overwhelmingly the primary virus that's being transmitted in Shelby County is the B117 variant that is highly transmissible, more transmissible, and also more dangerous than the wild-type Wuhan virus that we were seeing a year ago. So if we didn't have 345,000 people vaccinated, our case numbers would already be exploding. But because of those folks being vaccinated and the vaccine protects against that B117 variant, all of that is helping keep our case numbers low right now. And to the 2,300 Shelby County residents that are coming out every day to get vaccinated, whether they're coming to one of our mass sites or going to Walgreens or CVS or Kroger or wherever you're going, to your doctor's office, we just simply say thank you to every single one of you, and to all those people that are going to come over the next few days to continue getting vaccinated, because every person we vaccinate takes a person out of the pool of susceptible individuals for the virus to infect and continue to cause damage in our community.
My second question, I'm wondering if one of you can kind of walk us through what already vaccinated people should be doing to help improve vaccination rates in Shelby County.
That's a great question. I would say be an ambassador. Talk to others about your experience, if you've had a good experience with it, or why did you get vaccinated, right? Share your vaccine story. What was the important thing to you about it? And then At least in my instance, when I got vaccinated, the overwhelming sense I had was relief. You know, we made it to the point where we were able to receive the vaccine, and we were really grateful for that. And so I think if we tell those stories to other people who are maybe hesitant or not so sure, that can maybe be a useful thing to help someone make the decision to go ahead and take the shot. But beyond that, I mean, I think it's that word of mouth advertising, right? That's how do things spread in the community? How do we decide that that's something we want to do? A lot of times it's because a friend of ours or a loved one of ours has brought it up to our attention. So we would just say, please share your stories.
Looks like those are all of our questions today. Are there any closing messages?
No, just simply say thank you to everybody. You know, we're doing a lot of gratitude time at this time of year because we're really in such a better place than we've ever been before, and it's nothing that we could have done without you. It takes everybody to participate in the vaccine campaign in order to get us to a place of moving forward into normalcy. And so we're grateful for all of the folks who have taken advantage of the shot, but also if you haven't yet, and those of us who have been vaccinated, we still need to practice basic things just to prevent transmission of disease in general. Let's all keep washing our hands and using hand sanitizer. Let's all wear a mask when we're in mixed groups indoors where some people are vaccinated, others are not. That's the best practice to slow the spread of respiratory viruses. And let's maintain social distance, not crowding together more than we should, because all of those things foment the transmission of viruses. And even if you've been vaccinated against COVID, but you've been wearing a mask and you've been socially distant from people all year, and then you start mixing and mingling with other folks without a mask on in indoor air spaces, we're going to catch colds, we're going to catch potentially the flu or other respiratory viruses. And the measures that we took to protect us from COVID will also protect us from getting sick from other viruses. So it's always a good practice to practice some of these hygiene measures that we've learned over the past year. But in general, thank you. We'll see you again next Tuesday, and I hope you have a good weekend.
Thanks, everyone.